Thank you so much for joining us for a very special Facebook Live conversation. We are so excited to introduce you to Children's Hospital and Medical Center's new president and CEO, Chanda Chacón. Thanks for being here.
Absolutely. Thanks, Sarah.
We are so excited to help our community get to know you a little bit better. And we want to welcome you to leave any questions for Chanda in the comments below, and we'll do our best to get to those as we go through the broadcast. And also, you'll notice we're wearing masks.
Yes.
This is a new thing for our Facebook Live, so we'll do our best to project and enunciate and let us know if you have any issues. But I want to start really broad. What do you want our patients, our parents, our family members, our community to know about you and to know about your leadership?
So I think the most important thing for me that everyone knows is that this is personal for me. I had a really challenging health issue when I was a child, and I never touched a children's hospital. And so for me, watching my family go through that experience and knowing what it felt like for me as a child to go through that has given me a very interesting vantage point at which to lead from. And I realized in watching my family how big of an impact it's had, and that experience was 30 years ago. You could talk to my mom today and it sounds like she has a child in the hospital now. And so I have a real passion for helping ensure that we create systems and we have people that are trained to specifically care for patients and their families. And I truly believe that every child deserves the kind of care you can receive in a children's hospital. We have a really unique environment. We have employees and team members who are trained specifically to help care for children. And I think that is such a unique gift that this community and this region has with having a freestanding independent children's hospital here in Omaha.
And that leads perfectly into what I was going to ask you next, which is, what do you want? And we don't want to make any assumptions about who's watching. What do you want those watching to know about children that they might not realize?
That there are not as many independent freestanding children's hospitals in the country as everyone thinks. There are just over 30 of us, and while there are lots of children's unit or hospitals within hospitals that do amazing work, I am in awe that this region has such a great facility here in Omaha that can provide care to children and their families. And I think it really is a treasure that we have here. And our goal is really to ensure that we can provide amazing care to not only children here in Omaha, the state of Nebraska, but truly the region. And for people to understand that we are a quaternary care facility. The work we do here is broad and it is deep. And that is not only through the work we do within our walls, but the partnerships and collaborations that we have across the region is really important to us as an organization to impact child health.
So you mentioned this a little bit, but kind of give us a little bit about your backstory and the road that you've taken that brought you here to Omaha.
Sure. So I think the best way to tell that is in my journey as a child after a car wreck, touching lots of different practices and seeing a lot of different healthcare providers, I remember sitting in a physician's office, and it was before pets came into and dogs came into part of the care model in healthcare, and the door opened of the exam room and 2 Sheltie dogs ran in. And I remember thinking, you've got to be kidding me. Like, there's dogs here? And I will tell you, my trajectory of how I led changed on that day because the physician walked in and talked to me and really pulled me into a part of the solution to the challenge I was facing. And so from that journey really led me down a pathway to understand how I could impact care for families when they had a child in crisis. And I realized that was really about systems, and that was really about having people who are very smart try to navigate a really complex system, and we need to help make that easier for families. And so that really led me down the pathway of getting a degree in biology and Spanish. I was raised in Texas and really wanted to be able to speak Spanish, and then really set my trajectory on a career, the Master's in Public Health Management from Yale University, and that really helped blend together the science and the business part of the work that I do. And when I finally started my career, I remember walking in Texas Children's Hospital in Houston, and I thought to myself, I'd never been in a children's hospital, and it felt different, it looked different. I mean, even it smelled different. It did not smell like a hospital. And I remember walking down a hallway with children's art down the hall, and I thought, I have to be here. I have to work here. And that was such a profound moment for me, and I spent the next 15 years of my career working in very different areas of Texas Children's Hospital, really preparing myself and building my tool set so I could have an impact. And I don't think I knew at that time what that would look like long term, but I knew I wanted to impact the relationships we had with families and with patients. And from Texas Children's, my last role there, I was the president of one of our community hospitals there, and then made the move to Arkansas Children's in Little Rock, and was the system chief operating officer there, and helped that organization create a network of care across the state. And that felt really profound to me, to be able to impact the trajectory of the state, which leads me to this role here at Children's. And I think I have had some of the best experience in teaching from some of the smartest people that I know in pediatric healthcare, have had great mentors, and have really helped me shape my leadership style to focus on people. And for me, it feels like the absolute best time for me to be here at Children's to help us write the next chapter of our journey here.
And I heard you say that people first. What does that mean to you, and why is that so important, especially in pediatrics?
So I appreciate you saying that, and if you follow me on Twitter or on Facebook, you'll see my hashtag of people first. I truly believe that. I remember from my own healthcare experiences the interactions with people that I had. We expect as we go to get healthcare that you receive great clinical care. What you rarely expect is that you will be cared for. And that to me is so important, that we have people trained to care for families and patients. And those little moments and those little interactions help really craft a whole story and a whole journey for families. And they create memories that last a lifetime, the same memories that my family has. And so it's really important to me to realize that that happens because you have amazing people.
Yeah.
And so focusing on people helps then power amazing buildings like the Hubbard Center that we're getting ready to open.
Right.
I'd like to open it soon, and I know soon is like less than a year.
You're right.
But that would not be as amazing without great people powering that. Our programs that we have would not be able to get the kind of outcomes that they get and provide the kind of care if we didn't have amazing people. So I really feel like if you start at the beginning with putting people first, that changes the entire trajectory of where you go.
Wow. You mentioned the Hubbard Center, which kind of dovetails into this, the timing of this. What was exciting to you about coming here? What drew you to Omaha in this opportunity?
You know, for me, it is about watching an organization that has great people, that has great infrastructure, and a really strong foundation, that the Hubbard Center really helped us shore up. And as it opens, will allow us to ensure we don't ever say no to a child coming here. Because I truly believe in every child deserves to be treated in a children's hospital, it is important that we don't have to say no. And so for what that does for me is it creates a really strong foundation that we can then build what our future looks like. And that to me is really exciting, to be a part of writing those chapters with the leadership team and the community here. And that is it just feels like a really exciting time for us to craft what our future looks like.
Yeah, you were talking about that depth of care, and we did have a patient mom from Instagram ask, what steps does she plan to take to improve the quality of care? And this mom specifically said to long-term non-cardiac patients, but I think we could even broaden that out. I mean, how does the Hubbard help us do that, improve that quality of care that people have come to know us for?
Right, so I think we have to first start and say that providing excellent quality is at the forefront of our mission. It is about making children's lives better. That is part of our mission, and having amazing quality and great outcomes is what we are here to do. And each one of the patients patients that steps through our doors, no matter their condition or why they're here, is as important as the other patient. And it is our job to help create systems that make sure that happens. And what the Hubbard Center allows us to do is ensure that we put the most critically ill children in a coordinated setting that has the infrastructure around it to ensure we can get great outcomes and quality and continue that journey for families. So I'm excited about what the future holds with being able to provide that level of efficiency of care in the Hubbard Center. And that really, to me, equalizes every patient that comes here should have that same experience of knowing that their child, not just their child with a condition, but their child, it should feel as important to us as any other child walking in our doors.
So you're starting a new job, a new big job in 2020, which has been just a disruptor for everybody. So what would you say about COVID-19, children's response, and what our role is in that, in this community, how we're serving at this interesting and uncertain moment?
Sure, I think that's the one thing we know to be true is that it is uncertain and we are going to have to be agile. And I have seen and talked to people at this organization who have demonstrated amazing agility and really great and amazing service to patients and families. And I heard a CEO of a children's hospital say, healthcare leaders are trained to manage crisis. We are trained to lead in situations like this. But what we're experiencing is so different than anything any of us have ever experienced. And it has lasted longer than any of us have been in a crisis mode before. And what we are seeing happen is that normally healthcare workers come to work and it's a crisis, and they go home and things are good at home. Mm-hmm. What we're seeing in our team now is that it is unsettled at work and it is also unsettled at home. Right. And that is emotionally exhausting and that is trying. And what we need to do is help figure out how we resuscitate and rejuvenate superheroes. How do you do that? And I think that's something in healthcare we're all learning how to do, is make sure that we are helping make our team resilient and helping them before they ask for the help. And that, to me, is what we are obligated to do as a healthcare organization, is make sure that we have a strong, secure team that is resilient enough to manage this for the long term.
Yeah, that's such a good point. It's just hard all around.
It is. Yeah. It's difficult. And I've stopped asking people if they're okay.
Because you know the answer.
Because I already know the answer. It is hard, and it's a different way of leading, and it is really important for us as leaders to help put the humanity back into the work that we do, and realize that people are first in this, and we have to take care of each other.
Turning it to kind of the community piece, medicine's a team sport, but caring for children is a team approach. And you mentioned collaboration earlier. Why is collaboration so critical for children's health, in particular with kids?
So for me, the reason collaboration is so important is, much like you said, it takes a whole team of people, from the folks who clean the room, who prepare the food, who provide clinical care, to really make those memories happen and care for kids. But what we know about moving the dial on child health is that healthcare and hospitals and the provision of care really is only about 20% of health. And it's the other 80% that happens outside of our walls that really determine the long-term trajectory for child health. And so it's about those collaborations and those places where we cross over with other organizations who are doing great work around food insecurity and poverty and financial literacy and housing and education, that is really where the power comes, and really where you start seeing that sort of change that feels like a catalyst into moving the dial on child health. And so for me, that has always been something where I've been grounded, because of volunteer work that I've done, to really focus on where are those intersections between organizations that we help each other move faster and stronger to move the dial on child health.
You mentioned volunteer work, and I'm curious about that. And what are the passions of your life, not only on this job but outside of that?
So I was a court-appointed child advocate in Houston for a little more than 10 years. And when I was in Arkansas, I worked with an organization that helped foster families be successful. And so I tell people, while I don't have children of my own, I tell people I have 17 children because they're all a part of my quilt that I've woven about what helping children means to me. And as part of that work, it's been humbling and helped me understand the systems we have in place to be helpful and how organizations can work together to truly help change the trajectory for children's lives.
Yeah, I think it shows that it's a passion that's not just work, right? It
Yes.
is really who you are.
Yes, it is who I am. I tell people I don't know how to be anybody else.
There you go. There you go. So I'm sure a lot of people when they meet you are like, what do you want to do? What's on your to-do list? What are your, let's think a little, bigger. What are just your big priorities and what's your focus in this first 100-day period?
I like that you said 100 days, Sarah, because I have crafted my 100-day plan of what does that look like for me, especially being new to the area and being new to children's, and how can I establish my own strong foundation to make sure the work we do as an organization can have impact. And so for me, that really is about listening and learning and understanding the role we play in the community, where our team members want us to go, absolutely valuing the history of where we've been, but also understanding where our team members want us to go, where the physicians we work with want to go, where do our partners see us as an organization, so that as we lead into our next strategic plan and our next fiscal year, which will start in January, that my 100 days dovetails into that very nicely, so that the work that we are doing and what I have heard from people and learned can help us craft, our next 5 years at least.
We've talked some about your experience and your passion for pediatric health. I guess just to wrap up, to parents specifically, to families specifically, because that's a unique thing when they're trusting you with their hearts at this special place. What specifically would you say directly to the moms and the dads and the grandmas and the grandpas and all the people who love these amazing kids that we serve?
That this is personal for me. I have a passion for the work that we do, and I think about my own experience every time I'm out rounding, talking to families, and you will likely see me if you're here. I like to round, and I like to talk to families and understand what we can do better, what we're doing great, but that this is not just a job for me. It is, for me, truly, it's a calling, and I believe that our families, the patients we serve, deserve excellence from us. And that is our obligation to bring that game, to bring that type of work every day we show up. So I think for me, if I'm a parent, I would want to know someone is leading this organization who has seen their own family be in your shoes. And it is truly a personal calling for me to be able to sit in this seat. I am honored and humbled to be able to lead an organization like this and to truly have an impact on child health.
Yeah. Well, we're so very glad you're here, and welcome. And I know our fans are going to welcome you too. And I wanted to mention, because you brought it up, you are on all the social channels.
I am.
So follow you on Twitter.
Absolutely. I'm on Twitter, I'm on Instagram, I'm on Facebook.
LinkedIn.
I think Twitter is a great place to really understand how I lead. So if you're a family, if you're a parent, and you want to understand more about my leadership style and how I work, I think that's a really great place to learn more about me and my leadership style.
Good point. Well, thank you so much for your time. Thank you guys for watching. And of course, we've been talking about social. I want to remind you, of course, there's always the website, children'somaha.org, but you can also connect with us here on Facebook, Twitter, Instagram, and YouTube. So thanks for watching. Take care, guys.